Hey everyone, this lecture goes along with Chapter 5, Assessment. This lecture goes hand in hand with Chapter 6, which is Assessment and Diagnosis. In this lecture, for Chapter 5, it's sort of the initial stages of assessment. How do we determine if an addictive use disorder exists, to what degree, and to what level of care might a client need? And then, of course, Chapter 6 is going to go into more specific assessments that might determine treatment plan options or techniques and skills, and also really go into diagnosing um, addictive use disorders. Um, Sorry, I apologize for the transitions here. I thought I took them off, but obviously I did not. So, um, assessing and screening and diagnosing addictive use disorders is commonly missed. It is one of the most commonly misdiagnoses. It's because people underreport. So if asked if you think you have a problem with use, if you are still in denial or in maybe pre-contemplation, uh, you may not answer that question truthfully. Maybe not intentionally, but the answer may not be a clear representation of what's really going on with your client. Um, it's also quite serious. It's labeling, and if general public tends to use the word addict and think that there's still sort of this moral stigma associated with addictive use disorders. If one answers in a way that might lend itself to that diagnosis or even the thought or consideration of a diagnosis, then of course there's some stereotypical uh, stigmas and negative connotation associated with this. And then also, of course, considering the amount of individuals with an addictive use disorder that have another mental health issue, which is called comorbidity. We're going to talk about that in a great deal at great length from this point on. The idea that folks have other mental health issues in conjunction with an addictive use disorder, that other mental health issue may mask or cover up or even mimic some of the addictive use disorder symptoms, behaviors, etc. And so we might miss it. We might miss the fact that they have an addictive use disorder because we're focusing on some other mental health issue. So those are just some examples as to why this is a commonly misdiagnosis. And so you can see why screening assessment is critical and why doing so in an appropriate and effective manner can help us determine fit and treatment planning. But it's also important to know that we must come at this from a holistic perspective, and we'll talk about that here in a little bit. Again, I apologize. So the philosophical foundations of addiction counseling. So as an addiction counselor, what are some of the foundational principles and tenets of addiction, of working with addictive use disorders? A lot of these are similar to counseling principles. So you can see here on your screen, hope. We instill hope. We come from a strengths-based approach as opposed to sort of a morally negative approach where we discount the strengths of the individual. The whole person approach, again, like I said about looking at this from a holistic perspective, we need to consider every aspect of the individual. We need to consider not just mental health issues. We need to consider traumas. We need to consider physical health issues. We need to consider, of course, cultural issues, race, gender, ethnicity, sexual orientation, all of those aspects of the human being that makes them a person. So really considering the entirety of the individual, not just divorcing or segmenting off their addictive use disorder. Motivation. Where is your client? And to what degree are they ready to, one, maybe consider that there's a problem, and two, recognize that there is a problem and be able to sort of accept the idea that change has to occur in a variety of different ways. Another foundation of addiction counseling is collaboration. So it's important for us to not operate inside of a bubble. Just as we do with mental health issues, it's important for us to seek advice, guidance, and collaboration with psychiatrists and social workers and other clinicians and family members and Possibly even you might also be involved with the criminal justice system, although in an effort to help your client with their goals and their idea of what needs to happen for change. Using a multidisciplinary approach, the idea that not one approach is right for all clients. We're going to talk a great deal about this in a couple of weeks when we discuss 12-step AA treatment approaches, and then when we also discuss inpatient outpatient treatment centers. What you need to know is that, and we're going to talk about this a lot, regardless of and sort of despite the fact that we rely heavily on a traditional treatment approach, which is centered in AA and 12-step treatment, DSM and best practices dictates that we use whatever is best for our client. So if whatever is best for our client, whatever approach is the best for our client, is not in line with maybe an AA or a 12-step treatment approach, it's our ethical duty to meet our client where they are and to make sure that we provide them with all options. So an example of this would be the AA and 12-step sort of reluctance to accept medicated assisted treatment. Now, some major shifts are happening in that area, of course, but there still is this reluctance to incorporate medication for addictive use disorders, so particularly methadone, Suboxone, things like that. It's unethical for us to deny our clients that information so they can make the most informed decision about their treatment approach. And then, of course, advocacy. Advocacy is, similar to the rest of these principles. Advocacy is paramount to our work as counselors. We advocate for the field, we advocate for us as counselors, but more importantly, we advocate for our clients. I'm not going to go through all of these. You will do that. But essentially, it's what we just sort of went over. And again, I apologize in the transitions here. I did not mean for this to happen. The role of the addictions, let me just flip through my notes here. The role of you as an addictions counselor, and here it says the assessor because we're talking about initial stages of assessment, is to do everything that you see kind of flying across your screen right now. So it's your job to sort of figure out by way of questioning and assessment, so interviews and assessments, it's your job to figure out what is going on. What is the problem that is identified by the client, or maybe even if it's not identified by the client, maybe something that you're seeing that you want to keep sort of in the forefront of your thought to bring up as your client progresses and evolves in identifying what's really going on with them. It's your job to determine the appropriate level of treatment and give this information to your client so your client can make the best judgment call for themselves. The appropriate interventions, of course, it's your job to determine what's the most appropriate based off of a variety of factors that we're going to go over in a minute. Give this information to your client so your client can make the most informed decision. It's your job to involve family as needed. It's important here for me to mention that family for your client is how your client defines family. Family may not be mother, father, spouse, partner, children. It may not include the sort of prescribed ideas of a family that we tend to have in our culture, which is obviously, sort of the white Eurocentric culture, but it's important for us to involve family as the client identifies as family. Again, are you getting sort of a sense here? The client is the one that's making these determining factors. It's your job to determine how to handle all of this with your client, how to deliver this to your client. And it's your job to evaluate the effectiveness of intervention. This is the responsibility of this is on you. So it would be inappropriate for you to offer interventions that are not effective for your client, that go against counseling ethics and et cetera. So the idea, here's an example of this. It would be unethical for you to maybe say refer a client to a morally backed, or let's say maybe even a faith-based treatment program where the idea of the philosophy is that with enough prayer, the addictive use disorder can go away. Well, let me back up. With enough prayer and Christian support or religious support, that the individual can change their sinful behavior, ultimately leading to addictive use disorder going away. Does that make sense? And then continuity of care. Continuity of care is sort of the progression of care. So is your client constantly being monitored and maintained and seamlessly transitioning through all the different levels of care that need to happen that addresses his or her, or their rather, addictive use disorder in the most appropriate way. So I don't want to go too much into this because this is from your assessment class. The one thing that I do want to talk about here, when you're considering an assessment measure, so a formal or informal way of assessing those initial sort of interview questions, the initial screening for an addictive use disorder, we need to follow some of those assessment protocol that you learn in assessments. But the thing that I want to make sure that we touch on here is at this very bottom, so you can kind of see right here, be watchful of stereotypes. I don't know if you've picked up on this yet, but I'm very mindful to not use the word addict. And if this is a very labeling word, and I prefer to use individuals who struggle with addictive use disorders, or those diagnosed with addictive use disorders, or who identify having an addictive use disorder, as opposed to addict. We don't really do this in any other facet or with any other mental health issue, typically. So considering the stigma that's already associated with addictive use disorder, I think this is really, really, really important. And I would encourage you to maybe consider the language and how impactful in a negative way that using this type of language can be on your clients. Again, I'm not going to go into this too much. What I do want to point out here is this first thing, involve client at all stages. You heard me sort of discuss this. It is collaborative. You develop your treatment plan with your clients. You discuss with your clients everything that you're doing with them so that they are informed and can at any point say, I'm not comfortable with this and I want to stop, or this is not helping me. So a collaborative process and involving your clients along the way. I'm not going to go over that, but that's pretty self-explanatory. Structure of assessment interviews. Again, they can be unstructured, so just kind of like a person-centered approach to building rapport, or a motivational interviewing approach to addressing resistance. Of course, this can take some time, but really you're utilizing those counseling skills that are necessary early on to establish rapport and build a strong relationship, so that that strong relationship is there for you guys to continue to work when as you progress. Semi-structured, maybe it's a combination of unstructured and structured interviewing. And then, of course, structured interviews, these are measurements. These are screening tools. These are reliable and valid, and they've been tested. Negative, they're a little bit rigid, and you may need some training, but this could also, as you would imagine, compromise rapport. Your assignment focuses on this. Here's some components of an interview. I'm not going to go into this because you do this in skills, but make sure you are aware of this. ASAM criteria. I'm going to go into ASAM criteria. ASAM is the American Society of Addiction Medicine. I have a link for the criteria. We're going to talk about this a great deal when we talk about treatment settings, but know that your job with your client's collaboration is to determine what level of care your client needs to be seen at and in. So are you putting your client in an environment, or are you referring your client to an environment that they are not appropriate to be in? I'm going to pause right here and pick up with another video.